A little bit of change of scenery for today's video. Today's video is going to be what is POTS. So POTS stands for Postural Orthostatic Tachycardia Syndrome. The overview of what POTS is Postural Orthostatic Tachycardia Syndrome is a condition that causes your heart to beat faster than normal when you transition from sitting or lying down to standing up. It's a type of orthostatic intolerance. Within that, each different part of postural orthostatic tachycardia syndrome has its own little meaning. So each word has its own meaning. Postural is related to the position of your body. So laying, sitting, standing, leaning, kneeling, stuff like that. Orthostatic related to upright standing. Tachycardia, a heart rate over 100 beats per minute. And syndrome, a group of symptoms that happens together. So this is a lot of people think that POTS is a cardiac condition. It is actually not a cardiac condition. POTS is an autonomic nervous system issue. Your body's autonomic nervous system balances your heart rate and blood pressure to keep the blood flowing at a healthier pace, no matter what position your body is in. But people with POTS, our body can't balance. It can't coordinate the balancing act of blood vessels constricting, aka squeezing, our heart rate. And so it means that a lot of times when we stand up, our heart rate jumps and our blood pressure plummets, or our heart rate jumps and our blood pressure skyrockets. It really is dependent on the person. I also know a lot of the time people think POTS is only in girls. It is not. There are several men out there in the world that have POTS. POTS is actually extremely common. A lot of people think it's extremely rare, but it's really not. It's just not well known. POTS affects about 1 to 3 million people in the United States. POTS isn't life-threatening, but it can interfere greatly with day-to-day life. So because of my POTS, I am unable to work. It is just not safe for me to work. And so that is because of my POTS and my symptoms and stuff like that. But there's also more to it than just like my POTS. That is why I can't. So symptoms of POTS are very different for each person. Something about POTS is you can develop it suddenly or it can develop gradually. A lot of people who have had COVID or have long COVID end up developing POTS after. I'm not saying every single person that's ever had COVID has POTS. I'm saying people who tend to have long COVID, there's a big connect with long COVID and POTS because it messes with your body's systems. Symptoms can also happen immediately or a few minutes after standing up or changing positions. Lying down can relieve some of the symptoms, but not all of them. POTS has several different possible symptoms, and it really varies person to person. So some examples of symptoms for POTS are dizziness or lightheadedness, especially when standing up during prolonged standing in one position or on long walks. If I stand for too long, I find that I get dizzy, I get lightheaded. When I stand up, I get dizzy and I get lightheaded. Fainting or near fainting, which is also known as syncope or pre-syncope. So pre-syncope is almost fainting. Syncope is fainting. Forgetfulness or trouble focusing, also known as brain fog. Heart palpitations or racing heart rate. So when I was first diagnosed with POTS, I had an irregular heart rhythm because my heart was pumping 2 times quicker than it needed to be. I had 2 different electrical paths because I had Wolff-Parkinson-White syndrome, which is a whole thing in its own. But that actually led to me getting diagnosed with POTS during my second ablation because my heart was in a run of tachycardia and I wasn't doing anything. They just had changed my body's position. And so that was part of it. Exhaustion or fatigue. I know a lot of people with POTS also suffer from chronic fatigue syndrome. I am one of those people. Feeling nervous or anxious, I don't know. I know that palpitations can cause anxiety. That's all I know. Shakiness and excessive sweating. Shakiness, yes, when my heart rate is really high, I'm shaky, or other factors with that. Shortness of breath, which is what I just had there. Shortness of breath, or what we like to call air hunger, where it feels like you're not getting enough air in. You take a deep breath, but you're still not quite satisfied with the amount of air that you've taken in. Chest pain, that's another big one. Headaches, also another really big one. Feeling sick. If your blood pressure is too low, sometimes you can feel really gross. Same with if your blood pressure is too high, and if your heart rate's too high. Bloating. Bloating is mostly with comorbidities and stuff like that. A pale face or purple discoloration of your hands and feet if they're lower than the level of your heart. So a lot of times, people with POTS, sometimes they'll shower and they'll get out and their feet will be purple. I know when my heart rate is too high or my blood pressure is too low, or both, or I am going to pass out, I am pale. I am white as a ghost. So that's a big telltale. Disrupted sleep from chest pain, racing heart rate, or excessive sweating during sleep. I know a lot of us with POTS get heat flashes when we are asleep, and it's not very fun, but it happens, and we just have to learn how to deal with it. Unfortunately, POTS symptoms can often get worse in certain conditions. So here are some of the situations that would make my POTS symptoms worse. Heat. That is a big one. Being in a very warm environment, so hot showers, hot baths, or just outside on a hot day makes my symptoms so much worse, which sucks because I love taking baths and I love showering. But there are ways to go about that. Standing frequently, like when you're waiting in line or you're shopping. So that's why a lot of people with POTS, you'll see with rollators, if their symptoms are bad enough, they'll have a rollator to help so that they can sit when they need, or even some of us even have wheelchairs for longer days out to help with the symptoms of, okay, like me. When I go out and about, say it's the weekend and my fiance and I are going out and about, I have a wheelchair that I will use to help ensure that I am not pushing myself so far into my fatigue that I am unable to be a human being for the next week. And then my pain is better. My heart rate is at a more stable, consistent spot with itself. So another situation that can make your symptoms worse is practicing a strenuous activity, so exercise, which is funny because they also suggest exercise as treatment form, which is kind of funny, but it depends on the person, obviously. When you're sick, such as from a cold or have an infection, it can make symptoms worse, which also sucks. And then for my females, anybody with a uterus that still has a period, your period can actually make your POTS symptoms worse, which sucks because that means for a week every month, we are making our symptoms worse and there's nothing we can do about it. So there are several things that can cause POTS. Obviously, we're not 100% sure what exactly is the cause of it, but there are several subgroups that kind of have a little bit of a reasoning. So there's neuropathic POTS. This happens when peripheral denervation, loss of nerve supply, that's what that means, leads to poor blood vessel muscles, especially in your legs and core, aka your abdomen. Then there's hyperadrenergic POTS. I can't even. This happens when your symptomatic nervous system is overactive. And then there's hypovolemic POTS, which is reduced blood volume, can lead to POTS. Low blood volume can cause similar symptoms that may overlap in neuropathic and hyperadrenic POTS. There's also growing evidence suggesting that POTS might be an autoimmune disease, meaning your immune system attacks healthy tissue for unknown reasons. So, with that being said, there are still some unknowns in POTS. So, I feel like it's very difficult to understand fully what your POTS looks like. It's hard to go to other people and be like, hey, you have POTS, right? I have POTS. What's your experience? Because everybody is so different, especially with POTS. So here's how POTS is diagnosed. So I was not diagnosed with POTS in a typical way. I was diagnosed during a procedure where they were heating and freezing my heart in specific spots to stop my extra pathway, and that's when they learned I have POTS. I'm not quite sure how. All I know is that's when I was diagnosed with POTS. The main way providers diagnose POTS is called a tilt table test. The tilt table test measures your heart rate and blood pressure as you change posture and position. Besides the tilt table test, your provider may order other tests to help confirm a POTS diagnosis or rule out other possible causes of symptoms, including blood and urine tests for causes of POTS and conditions that mimic POTS, a test that measures the autonomic nerves that control sweating, so that's called a QSART, autonomic breathing test, this measures your blood rate and pressure response during exercise, a echocardiogram, I've had several of those, blood volume studies, and then there's something, I don't know what it's called, but they did this for me after I was diagnosed with POTS. I had my blood pressure and my heart rate taken, so I laid flat for 5 minutes, and then they came in and they took my blood pressure and my heart rate. Then I sat for 5 minutes, and after that 5 minutes, they came and took my blood pressure and my heart rate. Then I stood, again, heart rate, blood pressure after 5 minutes, sat again, and then laid down again. They didn't really tell me like anything after that. They just did it, and that was that pretty much. So, but that is, I know some people have been diagnosed with POTS in that way. So what is the treatment for POTS? Unfortunately, POTS is not something that can be cured. There are several strategies to help manage symptoms, and it is extremely individualized based off of your symptoms and what works for you. The main forms of treatment include exercise and physical activity, which doesn't work for a lot of us, but it works for a lot of us. And then diet and nutrition kind of it works for a lot of people, but it also doesn't work for a lot of people. So there's that. Medical compression stockings can also help blood pressure help push blood up from your legs to help reduce your POTS symptoms. They suggest that you wear full leg compression socks if your POTS is really bad, and it should help. Let's see. There's exercise that I said. Diet and nutrition, so increasing your sodium, drinking more water, eating small, frequent meals instead of larger meals during the day. Medications, there are several medications. So for my POTS, we started with sodium tablets because it is difficult for me with medications because I always tend to get the worst side effects of the medication. And I'm also just very bad at taking it. If it has to be taken at a specific time, I'm terrible at it. So there's beta blockers, there's a bunch of other medications. And then sometimes people with severe enough POTS will be prescribed IV fluids if they're unable to orally get in the fluids they need. So say you have POTS, but you also have gastroparesis or MALS or SMAS or Nutcracker syndrome or May-Turner syndrome, any compression or paralysis to your digestive tract. a lot of times you will go to an infusion center and get infusions, or you can go to urgent care and get IV fluids there, or sometimes even you'll get a central line or a port for IV fluids if that is what you and your physician have decided upon. And honestly, that's all the information I really have. I've had POTS for a while now. It first started my symptoms first started right before COVID had hit, and it was just, we weren't sure what it was. We thought at first maybe it was anxiety, but then with the tachycardia and it constantly happening, we realized it wasn't anxiety, and that's when we went to the doctor for it. And now that I have the diagnosis of also EDS and gastroparesis, it makes a lot more sense of me having POTS. And I think out of all of the chronic illnesses I have, POTS is a little bit easier to deal with mentally, I'd say. I'd say I'm not as upset about the POTS diagnosis as I am the gastroparesis or the EDS and stuff like that. But yeah. So if you guys have any questions, please comment them down below. I would gladly answer any questions that you guys have. Make sure to subscribe to my channel so that you don't lose me. And make sure to hit that notification bell so that you can get notified every single time I post. And make sure to check out my Etsy. I now have 2B tape posted. And if there's a specific design that I don't have that you would like, make sure to comment that and I will definitely create that for you. Bye. Love you.